Hi, I'm Michael, and this is California. And with the ongoing effects of the pandemic, new information has come out to show that there are some communities who are being disproportionately affected by the lockdown and the pandemic. And unfortunately, a lot of these communities are the ones that are most needy. And for example, these communities, oftentimes communities of colors, are having dire effects of the pandemic and the lockdown on both their health and their economic situations. And in fact, when we look at the disparity between the general population and these communities, it's quite vast. So today we're going to talk about how the pandemic and the lockdown has affected these communities' economics and their health situations and what can be done to help moving forward. Now, before we do that, if you like this information, if you find it interesting, you find it useful, please don't forget to like and subscribe. That way you can get updates when our newest and most informative videos become available. So let's first talk about the economy and how the economics of the lockdown and the pandemic have really affected the communities of color differently. So in the first section would be for jobs. So we can look at the unemployment rate for African Americans and for Latinos, and we see that for African Americans, the unemployment rate is at 16.6%. For Latinos, is at 18.2%. And it really kind of makes sense when you think about the types of jobs that our community members oftentimes do. They clean things, they cook things, they take care of other individuals to help them live with dignity. And all these types of jobs really require isolation to prevent the spread of a pandemic. So they're not only the first jobs to be let go, but they're also the last jobs to be brought back, if they come back at all. Additionally, if we look at the cost of living has really gone up exponentially over the last couple of months. And this disproportionately hurts communities of color for a couple reasons. One is they've already been dealing with very high rental costs. So for folks who are living in Los Angeles, living in San Diego, living in New York, they've already been dealing with astronomically high rent that's gone up over the last couple of years by huge numbers. Additionally, those rental and eviction protections that were afforded under the CARES Act are going to end in the not so distant future, which means that these communities who maybe had forbear those rent because they lost their job for the last 2 or 3 months, they're going to come due and have a huge lump sum cost in addition for moving forward rent all put together at once. Also, the cost of food has really gone up. So if you're looking at the cost of necessities, so like milk or eggs or meat, those costs have really jumped in the last couple months as well as a result of the lockdown and pandemic. And these communities' budgets were already strapped to begin with, and so even having these small increases is really dramatically affecting them. Furthermore, the cost of transportation or ensuring that everyone is clean and healthy and sanitary has gone up. If you look at the cost of cleaning supplies or face masks, those have gone up. Now, finally, the stimulus checks and things like that have been offered by the federal government oftentimes don't apply to communities of color because of the way the rules are written. So for example, if you have a household of 5 people and mom and dad and the 2 kids are all U.S. citizens, but somebody is claiming grandma who has an ITIN, it means that nobody in the household is actually going to be eligible for those $1,200 per person stimulus checks. Additionally, if we look at the healthcare stats of these communities, we notice there's a much higher rate of uninsured. And this is primarily because the type of jobs they do, because most people get their health insurance from their job. So if someone has a seasonal job or a temporary job or a migratory job or a job that's just low enough paying, it may not offer either health insurance or paid leave, which means that these individuals oftentimes are not going to the doctor to get looked at or to their PCP to get a diagnosis for the pandemic. So they're just avoiding it overall. Now, when we look at the 3 main things economically that affect these communities, so their jobs, the cost of living, and their health care, we can see that without government intervention in the near future or continuing moving forward, it really means that these communities are going to be affected now and may have multi-generational effects as a result of the economics of the lockdown and the pandemic. So let's talk about how the pandemic has affected the health of these communities of colors. And one of the biggest factors is the living situation. So if these communities of colors live in much more densely packed areas like rental or apartments, it means that they are going to be much more susceptible to getting the pandemic from somebody else who is nearby. Additionally, if they work in locations where there are densely packed individuals, so maybe a community health center or a factory or a packing plant, not by choice, but because they're side by side with somebody, it makes them much more susceptible to getting the pandemic. And unfortunately, we see that these numbers are panned out when we look at the infection rates, especially with regards to the infection rate for communities of color versus how much they represent in the total population. As an example, if we look at Iowa Iowa has a 20% infection rate for Latinos, but they only represent 6% of the total population. Here in California, they represent 37% of the infection rate. And a lot of this has to do with the delay in treatment and diagnosis of the pandemic in these communities, primarily because they have low rates of insured, meaning that African Americans tend to have a rate at 11.5% of uninsured, as well as Latinos have 19% of uninsured. So it makes sense. If they don't know how much it's going to cost to get diagnosed and treated, it would make them definitely very apprehensive to doing so or even delaying to get it done. Now, finally, these communities oftentimes have higher rates of obesity as well as hypertension, which are key factors in making them more susceptible to the pandemic. So really the big question is what can be done or what should be done by the government? And really, we got unemployment numbers that were optimistic last week, but at 13%, and again, that 13% disproportionately affects the peoples of color, it really means that there needs to be a lot more done moving forward, because at 13%, we are still at Depression-era levels of unemployment. And what that means is that there are going to be economic consequences that are short-term and even very long-term if something is not done by the government. So what I would recommend to be done is first do more of what has already been done. So another round of stimulus check to help folks from the time where everything is opening up from the lockdown to the time where everyone can get back on their feet and the economy is running again. Additionally, continue to expand and grow the social benefits programs that they have done in the last couple months. So for example, SNAP and Medicaid or Medi-Cal, allowing those programs to expand would mean that more folks will have health coverage so they can help avoid having such an intense pandemic by getting checked out early and getting diagnosed early because they have health coverage and they don't have to worry about what the cost would be. And then finally have additional programs for food or even unemployment benefits. So either expand unemployment continuously or maybe tie it to the unemployment rate. That way folks do not just get left out there in the cold when they are not able to get back to work right away. Now, either way, these are things that hopefully the government will consider doing because of the fact that without doing it, there are going to be long-term consequences. And if they do them, if they continue to expand these benefits that should have always been expanded but only got expanded out of the pandemic, it really means that we might potentially, as a community of color, as well as an overall community, be able to avoid such a severe pandemic in the future. Thank you so much for watching our video, and I hope that you found it interesting or useful or at least helpful. And if you did, please don't forget to like and subscribe. That way you can get updates when our newest and most informative videos are available. Also, if you have any comments or questions, leave those comments or questions down below. We love to see your comments and questions, and we'll be happy to make a new video or a new post as soon as we can. Now, other than that, I am Michael, and this is California, wishing you a happy, healthy day.